always a sexy topic, but it should be. Gonorrhea, chlamydia, and trichomonas can all be tested via urine or genital swabs.
Gonorrhea, chlamydia, trichomonas are easily tested for and easily treatable in most cases.
Long-term infection can lead to infertility. 70% of the people with trichomonas have no symptoms at all. All people who are sexually active under the age of 25 to get tested for STDs at least once a year. Your partner also needs to get tested because they may also be infected and can spread it back to you even after you get treated.
Sounds like getting treated is really important.
Welcome back. Today we are talking about sexually transmitted infections. It's not always a sexy topic, but it should be. Safe sex is smart sex. The Center for Disease Control recommends all people who are sexually active under the age of 25 to get tested for STDs at least once a year. And if you are over 25 years old and have multiple sexual partners a year, the CDC still recommends yearly testing at minimum. STDs, also called STIs, are a big topic. So we're gonna break it down into two segments. Today's topic, we will focus on the three most common and contagious sexually transmitted infections: gonorrhea, chlamydia, and trichomonas. All three are easily treatable, but you won't know how to get treated unless you get tested.
This is a tough topic. How are STIs spread?
STDs are spread via oral, vaginal, and anal sex.
Really? Oral sex?
Yes, you can get an STI from oral sex. You can actually get an STI even the first time you have unprotected sex. The only way to truly prevent an STI is abstinence, but that may not be realistic for each person. Remember to use protection with condoms and get tested before and after each new partner.
What is gonorrhea?
Gonorrhea is a very common, very contagious bacterial infection. Some sources estimate more than 1.8 million people in the United States contract gonorrhea every year. Wherever gonorrhea goes, chlamydia tends to follow. So much so that we actually usually treat both at once. Chlamydia is also a very common, very contagious bacterial infection.
Are gonorrhea and chlamydia treatable?
Gonorrhea is easily treatable with a one-time shot of antibiotics, such as ceftriaxone, whereas chlamydia is usually treated with antibiotic pills, such as doxycycline or azithromycin.
They seem easy enough to treat, but how do you know if you actually have gonorrhea or chlamydia?
That's the tricky part. Some people don't know they have gonorrhea or chlamydia. Symptoms can vary from mild burning when you pee, abdominal discomfort, vaginal itching and burning, change of vaginal discharge, discharge from the penis, rash on the penis or vagina, to no symptoms at all.
Yikes, that's scary that some people can have no symptoms at all. What about trichomonas?
Trichomonas is actually a parasite. It is also incredibly common. More than 2 million people in the US contract trichomonas every year. But it's estimated that 70% of the people with trichomonas have no symptoms at all. Since it is a parasite, this is a reminder they can actually be spread during vaginal to vaginal sex as well.
For the 30% of symptomatic people with trichomonas, what are the symptoms actually like?
Well, similar to gonorrhea and chlamydia, men can have burning with peeing or ejaculation, discharge or itching at the penis. Women can have vaginal pain, itching, burning, pain with urination, and change of vaginal discharge. Discharge can range to white, yellow, to green discoloration, and often has a fishy smell.
How do you treat trichomonas?
Now, trichomonas is also very easily treatable as well, usually via an antibiotic called metronidazole. Now, metronidazole can sometimes have a metallic taste in your mouth and can make you very sick if you drink alcohol with it.
How do I get tested for these infections?
Pretty easy, actually. Gonorrhea, chlamydia, and trichomonas can all be tested via urine or genital swabs. Again, if you're under 25 years old and sexually active, or over 25 years old and sexually active with more than one partner a year, it is recommended you get tested yearly for STDs.
Does my partner need to get tested?
Great question, yes. Your partner also needs to get tested because they may also be infected and can spread it back to you even after you get treated.
How long should people wait before having sex again after being treated?
The CDC recommends waiting 7 days after finishing all medications before having sex and having no symptoms. This will prevent you and your partner from giving or getting an STI again.
To summarize, the three most common STIs, gonorrhea, chlamydia, trichomonas, are easily tested for and easily treatable in most cases.
Correct. If left untreated, STIs can have long-term complications, especially in women. Long-term infection can lead to infertility in some cases.
Sounds like getting treated is really important.
That sums up our first segment on STIs. Tune in for part 2 for our heavy hitters. Syphilis, HIV, and herpes is up next. That sums it up well. Remember, none of this information should override or replace the recommendations of your doctor. We are not personally taking care of you or evaluating you. If you are concerned about an emergency or a serious medical condition, please call 911. Keep tuning in for more information about common medical conditions. And don't forget to like and subscribe if you find our content helpful.